Every morning I wake up, I have to look for my glasses to put them on and see what is happening around me. Or I have to prepare myself while using contacts in order for me to be able to function throughout the day. The only problem with that, they are not the best solution. There has to be a better way. So I called my brother, who is conveniently enough working at an eye clinic.
Dude, I am tired of wearing contacts. Is there like anything I can do to just stop wearing contacts and glasses?
Yeah, there's Lasik.
You think it's something I should do?
Yeah, for sure. It helps many people. I mean, I work here, so.
I'll be there tomorrow, bro.
Awesome. I'll schedule you in.
All right. Bye.
So I hopped on a plane and went to go talk to a doctor.
Dr. Farouk Ashraf, I'm an ophthalmologist that specializes in refractive surgery. Refractive surgery is when we're changing the focus of your eye, basically eliminating the need for glasses or contact lenses with a surgical procedure. The most common that everyone knows about is Lasik, where you are changing the shape of your cornea using a laser that changes the topography of the cornea so your focus is back on the screen and you're able to see without your glasses and contacts. The procedure itself is really fast. Typically it just takes a few minutes once you walk in that laser room and walk out.
So we checked my vision.
See that screen up there?
Yep.
Perfect. This is blurry, right?
Yeah.
Can you read the bottom?
T-E-N-Z-O.
Excellent. Blurry again, right?
Horrible.
Horrible. Where is the best, sharpest spot? Somewhere back
Probably
here.
about there, yeah.
Remember, summarize, you got three choices: glasses, contact lenses, surgery. None of those three are perfect. They all have good points, bad points. So just want you to be aware of that. Recovery is very easy. The first 1 hour, 2 hours, your eyes are a little irritated. So I tell my patients, go home, take a nap, take a rest. And typically by the evening, next morning, you're about 90%. Avoid physical trauma to the eye. No swimming for about a week. I don't want water in the eyes. But you can go back to computer work, back to work. If your eyes are a little dry and irritated, I tell people just lubricate it with artificial tears, but not much restrictions.
Okay, I think I'm ready. I think I'm ready for the surgery.
Wow, that's all it takes? You're easy.
I've been
cameraman.
And because I had a trip to Bahamas where I wanted to swim, I scheduled myself an appointment 3 months later and forgot about it.
2 days away from the surgery. Not sure how it's going to go. It should be fine, but I am concerned that I'm not going to be able to see. I still do believe that it's a good thing to proceed with it. And I'm hopping on a plane, ready to go get my LASIK, and should be good to go. I just landed in Atlanta in front of this medical facility now. I'm gonna step in and see what they have in store for me, given that I am gonna be here tomorrow, and then I should have perfect vision. Now, hypothetically speaking, something can go terribly wrong, and I'm gonna end up in a position where not only do the glasses not help, but I'm also not gonna be able to see anything for the rest of my life. Let's go. I was able to see how everything is done, and to be quite frank, given that there is no doctor here, I have no idea what's going on.
And as I was roaming the rooms in the doctor's office, obviously with permission, I started freaking
Maybe
out.
showing up here earlier was not a good idea, especially given that now I am freaking out. This little sign right here is scaring me, truly. Is that even safe? My initial visit that you saw earlier in this video was 3 months ago, and I knew that I'm getting LASIK. But for the last 3 months, I avoided thinking about it, and now it's becoming truly real because I know I have no way to avoid it. I mean, I guess I could just not show up.
So for my own sanity, I decided to go and get some breakfast.
This shake is
The best.
starting to rain. Whenever it starts raining outside, it drips on my glasses, which then impacts my vision and quite frankly annoys me. But after LASIK, I should not have this issue anymore because glasses are not going to be there. Today is the day of the operation, and I'm actually very excited to get my vision back. The upside is there. Whatever happens, happens. Let's do it.
So, read over this. If you have any questions, please let us know.
So possible long-term complications of LASIK include haze, glare, halo, loss of best vision, IOP elevation, and dry eyes, but not limited to them as well. It should be clear.
So while I was waiting, I decided to speak to other people who were waiting for other procedures to get my mind at
What
ease.
brings you in here today?
So I'm getting just a touch-up. I had 2 lenses put in. I actually came to Dr. Ashraf through a referral from a very close friend of mine, terrific practitioner, and it gave me the opportunity to get comfortable, and I had no qualms whatsoever about getting the procedure done. Probably wouldn't go to anybody else.
This is the second time I've had LASIK. I had it about 20 years ago, about 24. My vision was much worse then, very nearsighted. I had to work. I had to get up in the mornings, put contacts in, or put my glasses on, or I couldn't see anything hardly.
Gotcha.
The LASIK was so easy and so quick and just perfect last time that it was a no-brainer when I found out, like, can I do it again? And he was like, yeah, you can do it, more than once. Yeah, I did some research and all, and I felt like this clinic had the best reviews, best patient experience I'd seen in a while. I 100% would recommend it to anybody. It's so worth it.
I'm actually excited right now. My life is gonna have exponential increase in quality. That would be truly insane to not have to wear glasses, contacts, and just wake up in the morning and be up and ready. They're gonna verify the measurements of what needs to be corrected, and then we're gonna go directly into the surgery room and get that done right away.
When you come in on surgery day, we recheck our numbers to make sure nothing has drastically changed. And that's rare. If for whatever reason your numbers do change and it's significant, you are the patient that we have to delay your surgery further.
My cameraman is getting convinced to get Lasik himself.
The scariest part for me is having my eyes held open.
Yeah, you know what? It's a mind block. You're like everybody who does LASIK, right? Everybody's shaking. I mean, nobody wants surgery on them, especially with their eyes, right?
It's like a few hours, right? And then you just wake up and you're fine.
Just takes a few minutes.
Well, this is it. This is the moment we've been waiting for.
And it was in this moment I knew that I have committed. If I were to say I was not afraid, I would be quite literally lying.
Everything went very well.
Honestly, it's not as scary as it seems. Also, pain-wise, non-existent.
This one's even easier. The only thing with this, the light is a little bit brighter. Eyes closed. Okay, see that green light yet up there? That's our target there.
And on this second machine, they were actually making the corrective surgery for my vision, and I was about to walk out a new man with perfect vision into this world.
All right, where am I going?
I'm back right here.
How you doing?
I'm good.
Oh, wait, let me take a look. Oh, nice. Blink. There, that's perfect. How you feeling?
I actually see a difference as far as sharp.
Blurry.
It is blurry. What I'm saying is as far as sharpness, I wouldn't be able to read this right here perfectly sharp. And it is way sharper right now than it was before.
Literally been 2 minutes.
Right, and it's constant, the bluish tint that I had is dying down, and it feels like it's getting progressively better, which is
Excellent.
like a bizarre experience, to be honest, but it's like a good bizarre. I'm crying. Life-changing experience.
From my perspective, everything went well. So this is what's going to happen in about 10, 15, 20 minutes. The anesthetic's going to wear off.
It slowly is.
Okay.
I'm getting that little
this
burn.
This is the worst part. Burning, stinging, tearing. Oh, I can't open my eyes. 1, 2, 3 hours. Go home, close your eyes, get through it. Just get through it, that's all. Once it goes away, you'll know. It feels better. I can open my eyes. That's number one. Number two, vision. Like you said, you can see. Today is your big day. Every hour it's going to kick in. One eye may see different than the other. Who cares? But hopefully by tonight, tomorrow, you should be at 90% level.
Amazing.
Now, the last 5, 10%, that takes weeks. So next few weeks, you'll have good days, bad days. One eye may see better than the other. You might say, gosh, dog, I see better in the morning than the evening. This is all normal.
Easy.
It'll get there. You got to have faith in your surgeon, your facility, and just breathe and say, you know what? They know what they're doing. I'm going to put my health or my eyesight in their hands and forget about everything.
It is like I said, it's progressivovely getting better. I can actually read the middle line right now.
Wow.
N-Z-H-O-T.
Yeah.
And the bottom one is T-E-N-Z-O.
That's one line for 2020. We're almost there.
Wow.
It's been about 5 minutes.
Crazy. It's only been 2 months since I've gotten my eye surgery, and it has been life-changing. I wake up in the morning, don't have to put on any glasses, just start my day, ready to go. I did not expect it to be this good, and I also was terrified for the whole thing. But given that I just went through the surgery, looking back, would I change anything? And the answer, honestly, not a thing. If I ever needed to do this again, I would not even think twice and just sign up, go get it taken care of, and move on with my life. The quality of life has tremendously increased with me getting the eye surgery. I did not know that the doctor is going to sponsor the video until I was actually ready for the surgery. So realistically, it's really an unbiased review, but I did get sponsored. So vision is clear, life is amazing. Check out Dr. Ashraf, link down below. Get yourself LASIK. Stop wearing those glasses, stop wearing the contacts. Think for yourself, but my personal experience, I would do it again if I have to.